So everybody, please welcome Nerissa Askelin. So Nerissa Askelin commenced her nursing career as an assistant in nursing, completing further study to become an enrolled nurse, and recently graduated as a registered nurse. Nerissa uses academic, personal and work skills to make changes in policies and guidelines that influence dementia care for patients in the hospital setting. Nerissa hopes to be accepted into honours with a vision to complete a PhD and to become a gerontologist, nurse practitioner. And Nerissa, you haven't mentioned that you are also winner of the COPE Award, the Caring for Older Person Excellence Award at University of Canberra this year, which is a fantastic award that was set up by Karen Strickland in honour of our dear colleague Sarah Cope, who some of you in the room may have worked with in the dementia space. And who sadly died a couple of years ago, but was also so passionate about this space, and we do a lot of this work in her honour too. So Nerissa, we would love for you to take the Zoom floor and to tell us all about you.
Okay, thank you very much everybody for having me to talk to you today. My name is Nerissa Askelin, and 7 years ago I started on a journey to improve the lives of our most valuable assets, our elders. I knew a friend of a friend who mentioned to me that a gentleman needed assistance with going to the gym, going out for coffee and going to the movies. And she asked me, was I interested in earning a little cash on the side? Would I be interested in becoming a personal carer for this gentleman? This gentleman was diagnosed with posterior cortical atrophy, or PCA for short. Of course, I didn't know what a diagnosis of PCA meant. PCA is an aggressive form of dementia that initially affects the person's ability to read and write. This diagnosis was devastating for him, as he had a Master's of Letters and loved to read and write and play musical instruments. This chance meeting changed my life completely. I decided in order to provide holistic, person-centered care, I needed to understand what dementia actually was. Like many others, I thought that dementia only affected the elderly. I knew dementia was an umbrella term that described several neurological conditions affecting cognitive function. But what I certainly did not understand was the depth of the meaning of being diagnosed with dementia. So I started on my dementia journey. I enrolled in every dementia course under the sun that I could lay my hands on. I stumbled across the University of Tasmania's massive open online course, Understanding and Preventing Dementia, and I devoured all the material I came across. And the more I learned about dementia, the less I knew about dementia. I needed to learn more, and the only way to do this and to try and understand the dementia journey of people living with or affected by dementia, I decided that I needed to get hands-on and I needed to become a full-time carer. And I applied for a position at a residential aged care facility in Canberra. I was not sure, honestly, if I could hack it, if I could become a carer. So I enrolled in a Certificate 3 in Ageing Support and Community Care, and then a Certificate 4 in Ageing Support. After a few months, I was rostered on to work in dementia-specific memory support unit. I was so excited. All of the study I'd been doing was finally going to pay off, and I could put everything that I learned into making a difference for the residents living in the dementia unit. Well, my rose-coloured glasses came off pretty quick. I was absolutely horrified. It didn't take a royal commission into aged care to make me realise that what I was experiencing in the dementia-specific ward was not right. Poor staff-to-staff ratios stretched even the most passionate aged care worker to breaking point. And let's face it, most people who work as assistant in nursing or carers in aged care don't do it for the money. They do it because they value society's most important asset, the older person. Well, it wasn't all bad. The relationships I formed with the residents played an important part in who I wanted to become today, an advocate for those who cannot advocate on their own behalf. I was so passionate about toilet timing incontinence products that I completed Certificate 2 in Incontinence Promotion and Care. I took this certificate to the management, and I was waving it really proudly, and explained to them that 3 incontinence pads daily for some residents wasn't enough. So they tasked me with completing incontinence assessments and ordering incontinence products for the residents. And I earned the title of Tina Champion and was awarded a certificate and a badge that I wore with pride. But this was not enough. I really need management and other staff members to join me in making aged care sexy. I needed them to listen to me, to feel my passion and share my dreams of promoting better conditions for older people and for those living with dementia. So I enrolled in the Bachelor of Dementia Care through University of Tasmania. And the more I knew about the brain, the less I knew about the body. So I enrolled in a Diploma of Nursing through the Canberra Institute of Technology. After completing my Diploma of Nursing, I applied to the Transition to Practice program and requested that my first rotation as an enrolled nurse was to be on 11A, acute care of the elderly. I learned new skills, especially about how quickly the older person could deteriorate, how delirium could be masked by dementia, and how delirium could alert a health practitioner to the possible misdiagnosis of dementia. My second rotation was on 7A, neurostroke and infectious disease, and I saw firsthand how stroke could impact on a person's life, resulting in a future diagnosis of vascular dementia. I also witnessed medical miracles whereby a person would be admitted into the stroke unit completely paralysed down one side, and after treatment regain movement in the affected limb. Currently, so during that time, I was working full-time as a enrolled nurse and studying a Bachelor of Nursing through University of Canberra, which I finally completed in July this year. And to my amazement, I applied for 17 registered nurse jobs and got 17 job offers. Here we go, that, you know, we're so much in demand. But anyway, I was offered a registered nurse position in theatres, in the emergency department and in PACU, and all according to my co-workers' sexy nurse positions where I would gain mad skills. I should have been elated, but I wanted to work with older people and people living with dementia. So every day for a week, I checked my emails, waiting. Oh my God, you know. And finally, I got the phone call I was waiting for. I got offered the opportunity to work full-time in the Mildura ward at the University of Canberra Hospital. And for those of you who don't know, Mildura ward offers rehabilitation for the older person, and the doctors there are all gerontologists. I was elated. I got off the phone and I screamed to my husband, I got my dream job. And so when I told my work colleagues, kind of a bit of elation went away because I told them I accepted, and some of them looked at me like I'd grown two heads. The comments I got were, why would you want to go and work with Jerry patients? And that is where nurses go to retire. And the other one, which really upset me, is that you're going to lose your nursing skills. But on the good side, working colleagues who knew me very well, my passion and my journey were just as late as I was. They were saying, congratulations, you are finally going to make a difference. You go, girl. You go make aged care sexy. I've been there for about a month and I love it. I happily volunteer to go to the falls rooms each shift, even though it means I have a 6-patient workload. I get to look after our most valuable assets, the older person. The falls room is for confused patients who are at high risk of falls. Some of the patients have mild cognitive impairment, some dementia, and some delirium. I feel that I've come full circle as I get to work in partnership with assistants in nursing who assist me in caring for these wonderful people to help me keep them safe. I see firsthand the empathy, compassion, and kindness the assistant in nursing shows these older people and give them the respect that they rightly deserve. So I think I class that as sexy nursing. So Kasha, if you could put on the little picture I showed you, I'm going to do a little case study because we all love case studies as nurses. So here's a quick case study. An 87-year-old female was brought in by ambulance after a mechanical fall in a movie theatre. Removing her safely from the theatre took 2 ambulance teams and 1 fire brigade team. Post-operation, the 87-year-old patient was admitted to the ortho ward with a hyperactive delirium brought on by hypersensitivity reaction to morphine. So with permission, if we could have the little, there we go, that's Grammy. So this is my mother-in-law, Grammy, and the grandmother of my children. So I visited Grammy last weekend and she told me a story of how the morphine made her hallucinate. And she kept trying to get out of bed, and she pulled her cannulas out And she kept accusing the other occupants of the 4-bedroom room that they were trying to get into bed with her. And in her own words, she said, "This beautiful little girl turned up and held my hand and kept telling me that I was safe and I was going to be all right. She kept me safe. She kept me from falling over. She helped me stay orientated and to what the time was and where I was. She helped feed me, she dressed me, and she even showered me. Words cannot describe the appreciation I wished to convey to her. I learned later on that she was assistant in nursing, so I wanted to say thank you so much for keeping me safe."
How wonderful. I hope you get a chance to read some of the comments that were put into the chat. Others have seen how your passion most likely is going to be infectious, and you'll have a positive impact on the junior registered nurses that follow behind you, Nerissa. And what a well-deserving award winner for the COPE Award, Kasia and Karen from Canberra, and your other colleagues from Canberra. I see Joe's there too. For us, you're exactly the type of colleague we want to be a champion for GANA, and perhaps colleagues like yourself, when they're still the students, the AINs and enrolled nurses, to be the champions for GANA, for leading the way, for inspiring new colleagues to join aged care and understand how rewarding it is.